Hello guys, today I am going to explain about the clomiphene. And clomiphene is a selective estrogen receptor modulators. As we know, clomiphene is to treat infertility in both polycystic ovarian syndrome patients as well as in unexplained infertility. So first we need to understand about the mechanism of action about clomiphene. Normally the clomiphene act upon the anterior pituitary gland, which is responsible to release gonadotropin releasing hormone, and it makes the anterior pituitary gland to down regulate. So when this anterior pituitary gland down regulated, there will be reduction of gonadotropin releasing hormone. So when this gonadotropin releasing hormone is reduced, there will be further reduction of both follicle stimulating hormone and luteinizing hormone. When this follicle stimulating hormone is reduced, there will be loss of negative feedback. Means when normally the follicle stimulating hormone has a negative feedback on gonadotropin releasing hormone to decrease the follicle stimulating hormone and luteinizing hormone. So when there is a reduction of gonadotropin releasing hormone, follicle stimulating hormone is reduced, so loss of negative feedback, so there will be further increases in follicle stimulating hormone and luteinizing hormone. When this follicle stimulating hormone increased in size, there will be folliculogenesis and ovulation. Because of these two mechanisms, it is used to treat infertility. Because of this increased folliculogenesis, there will be risk of multifetal pregnancy. So because it is acting centrally, there will be two main side effects of this clomiphene. First side effect is there will be presence of headache, and because it acts on the pituitary gland centrally, there will be visual disturbances. So when we prescribe this clomiphene to a patient, if the patient experience any of these two side effects, we immediately has to stop the clomiphene tablet. Okay, then how to give clomiphene? Clomiphene usually given in the day 5 for 5 days. For example, day 5 to day 9 you should give. Then immediately you need to stop. After 5 days of stopped clomiphene, there will be presence of LH surge. LH surge is mainly responsible for ovulation to occur, and this LH surge initiated by a hormone called estrogen. So from day 5 you are giving this clomiphene from day 5 to day 9 and leave a break for 5 days, and after 5 days you immediately notice the LH surge. Then you need to follow 3 steps. You can either follow any of these one. The first step is after 5 days of stopped clomiphene, that is day 10 to day 14, 1 week, we need to say the patient to have intercourse for continuously 1 day, only for 1 week, so that there may be a presence of ovulation and there may be a chance of conceive. And second step is use urinary LH kit, luteinizing hormone kit. I said that after stoppage of this clomiphene, there will be rise in LH surge after 5 days. So use a LH surge kit. If the LH surge kit shows 2 lines, then there will be LH surge positive. So again we need to say the patient to have intercourse for continuously 1 week. Or else third step, this is the most practical steps which is carrying among nowadays. The third step is to do transvaginal sonography to analyze the size of the follicles. If the size of the follicles is greater than 15 millimeter, then there will be a chance of ovulation. So we need to say the patient to have intercourse again for 5 to 7 days. And when we follow this third step, we need to do a ovulation trigger. The ovulation trigger can done by giving an injection of HCG of about 5000 international units. Okay, then the rate of ovulation with this clomiphene citrate is about 80%, but the rate of pregnancy is very low because this clomiphene has an antagonist action on the cervix, uterus and vagina. So when we give this clomiphene citrate, the endometrium became very thin. When the endometrium became thin, there will be decreased chance of implantation, and also it makes the cervical mucosa thick. When the cervical mucosa becomes thick, so it is very difficult to pass sperms through it. So the rate of pregnancy is very less with the clomiphene. That's it about clomiphene. The main use is to treat infertility. That's it. Thank you guys. See you in next video.